to welcome to this webinar. We'll introduce to you the MA program in Bioethics and Medical Humanities at Case Western Reserve, and as I said, look at how bioethics and medical humanities might inform and assist and help with your career trajectory, and hopefully, answer some other questions along the way. I want to get us started. Oops, I've got to use this. There we go. My mouse is really sensitive, so I'm going to stay with the arrow keys. Leah, do you want to introduce yourself and give an overview of the agenda?
Yeah, so hi everybody. Welcome to our webinar. We're so glad you could join us. As Dr. Aulisio said, we're going to talk about our master's program. We're very excited with our program. Today we're going to cover a little bit about CASE itself, but then we'll talk about the program overview, the outcomes, we'll talk about student life, student assistantships and financial aid, and the application process deadlines. One thing I did want to point out before we move any further is if you have questions, if you could submit them through the Q&A feature, we will both respond to them by typing responses, but also ask the questions during the webinar as well. So that's the best place to submit your questions. So I'll move on to introduce our panelists. So you already heard his voice, but we have Dr. Mark Aulisio. He is the chair and professor of bioethics. He's been at CASE for 20 years now.
Yes, indeed.
And she will be joining us late, but she will join us, Dr. Eileen Anderson-Fye. She's director of education and a associate professor of bioethics in our department. And we have two alumni joining us today, Anna Goff and Keely Newsom. They both graduated this past May from our program. We're very excited to have them join us and to talk about their experiences in the program as well. So Mark, I will turn it back over to you.
Okay, so real quick, Anna, do you want to say a little bit about yourself, and then Keely?
Yeah, sure. Hi, my name is Anna Goff. Like Dr. Jeanette said, I just graduated from the program. I am originally from East Lansing, Michigan. And I guess I'm going to be coming back to CASE to start a PhD in bioethics. So I guess
that's like hoping you would say that.
Yeah, and then I'm actually the same. I just heard back today, so I'll be coming back too. And I'm from Toledo, so CASE all around too. Did my undergrad, my MA, and now the PhD. So great institution, great program. This will be fun.
Well, we're really happy to have you guys. And for those of you joining us on the webinar, you got to cut us some slack here because this is only our second webinar, well, maybe third, but second this year where we've involved students. And the first one, I didn't realize that my webcam was not plugged into the USB port, and it was also the microphone. So we did a whole webinar and nobody could hear anything. Well, the joke was on us. Not this time. Okay, but Keely, Anna, really glad you're here, and Dr. Anderson-Fye will be joining us shortly. Okay, let's push forward. CASE is, really a national research university and excellent in a number of areas, as you see here: social work, health law, doctorate in nursing. In fact, the nursing school, one of the people who did a lot of bioethics for years and is now retired, Barbara Daly, helped pioneer acute care nurse practitioning. So really some innovative and interesting programs here. Masters in nursing as well, our strong MBA, and then our medical school for research. We're actually up to about 16 now, and hoping to rocket a little higher. And we have outstanding students. So just to give you a sense of our medical education, we're probably somewhere between 1, 2, or 3 for the caliber of our incoming students. Our average MCATs in the medical school in the last 3 years have been the following. These are the averages: 96% or 97th percentile, 96th percentile, 98th percentile. So we do medical education superbly well. And those of you who end up in the program, you'll have classmates who are doing the MD/MA, because we usually have 5 or 6 in any given year who join our master's program and end up in foundations with the full-time incoming students in that year. So a strong institution, and we're really fortunate and happy to be part of it. And we're under the umbrella of the School of Medicine here. So you say, why bioethics and medical humanities? Well, in a way, right now, this is like the easiest question to answer, right? What's happening in Arizona right now? For the first time, officially, crisis standards of care are being implemented for allocation of scarce medical resources. And I think, you know, everybody who hasn't been living under a rock realizes that there are screaming ethical issues when it comes to rationing, when it comes to allocation of scarce resources, but actually in and around biomedicine and the life sciences. There are value conflicts, there are uncertainties that need to be identified, analyzed, and that we need to work to resolve. So that's sort of the bioethics side, but what's the medical humanities side? Well, complicated issues, for example, like allocation of scarce medical resources or vaccine development on a fast track. We have these RNA vaccines that we're running after. Moderna is very hopeful, and God, I hope they're right, about having a vaccine ready to go as early as September, and maybe a million, what do they think they can do, 100 million doses. But there are a lot of complex value-laden issues that go into these types of endeavors. And one of the things that medical humanities lends is multiple lenses through which to look at those issues, whether they're issues of structural inequality. So we see how COVID seems to be hitting certain segments of society, especially those who are in disadvantaged areas and resource poor areas, much harder than in other areas of society. Why is that? What are the structural issues there that set people up for extra vulnerability? Medical humanities lenses look at those kinds of issues. So do bioethics lenses. But when you have a complicated issue, when you have value-laden matters and you want to tease it apart and you want to be able to move forward in a way that is constructive, you need lots of disciplinary perspectives, you need lots of lenses, you need lots of smart people engaging. So why bioethics and medical humanities? There's a big reason why right there. If you've had a bioethics or medical humanities class and you found it to be engaging and interesting and kind of tugging at you, then this could be a good fit for you, okay? Do you guys have any, Keely, Anna, anything to say about that? I got to remember to be sure to involve you. I'm used to doing the solo here.
Yeah, I think you definitely hit it spot on. That was one of my favorite parts of the program, was the fact that we had so many disciplines acting in one space, and it wasn't necessarily, it wasn't that one lens was like better or worse off than the other, but we all were able to come to like very interesting conclusions. Yeah, I really loved it. I mean, my background is political science, and I was worried I'd be like, I have no idea, like, I don't know, how can I contribute? But I definitely was able to. So yeah, I really liked that aspect of the program for sure.
I agree with that. I think it makes for a lot of really interesting conversations. Like, you'll, in this program, find yourself having like really deep and challenging conversations with peers and professors every single day. And every person that's a part of those conversations brings kind of a different perspective. So I think that that's where the medical humanities part is really unique to our program, because it influences the way that you kind of approach the questions that are coming up.
Hi, everyone. And Dr. Aulisio, I'm here. This is Eileen Anderson-Fye. And it's great to have Dr. Jeanette and Anna and Keely with us as well. I just wanted to second what you were saying and add, can you hear me? Actually, I'm getting a strange thing on my screen.
We can hear you, Dr. Anderson-Fye.
Oh, thank you. Oh, you know what? Wow, there's always a new challenge in a webinar. We're getting good at this in the Zoom time. Dr. Jeanette, could you share your screen because Dr. Aulisio's power went out?
Sure.
We'll get back up there. But while we're doing that, I will say hello, introduce myself quickly. I apologize. I knew another meeting was going to go a few minutes into this. I am the Director of Educational Programs in the Department of Bioethics. I'm a medical psychological anthropologist. Delighted to be working in bioethics and medical humanities. Another thing I'll just say about that combo is the different levels of analysis that we need to bring on. So Dr. Aulisio, I think his example with COVID-19 is, unfortunately a really good one to look at inequalities, to look at the levels of analysis. We have to work on biological advancement and vaccines and trials and all of those kind of biomedical issues, but we also have to look at PPE and public health ethics, and we can even look globally and we can see why some countries are doing better according to different ways of assessment than other countries. Pre-pandemic, one of the examples I would always bring up is more children die in the world of diarrhea than any other problem. This is not needing a sophisticated medical technology. This is something that is easy to prevent, easy to cure, inexpensive. But why do over 1 million children a year die of diarrhea? It's because of social factors, social justice, political economy, all these other types of factors. So the ethical issues, the social issues, the humanistic issues, the structural issues, and levels of analysis between humans, the environment, other species, international, intracultural, all these types of variation, we try to distill down and give you the tools that you need for your career path, for your path of study, to be able to look at the problems that you want to grab onto and make better in the world. One other just quick procedural thing I want to mention, which Dr. Aulisio might have said, we really encourage you and welcome you to write in questions as we go along, and we'll do our best, and we'll definitely leave time to answer questions. Okay, let's go ahead and advance. So how does bioethics and medical humanities help you in your career path? Dr. Aulisio, if he gets back on, he can jump right in. But we have students who come in from a wide array of disciplines. Some of them are pre-medical or pre-clinical, and they're going to go on and be clinicians. Some of them are working at a policy level. Some of them are working in academic research or in regulatory capacity. But whatever it is, we distinctly and deliberately shape a diverse class who comes together for an intensive year or an intensive 9 months to learn principles of bioethics and medical humanities, practice analytic techniques, get mentored by someone who has worked in your career path or your aspirations, or who has knowledge about where you're going, so that you can grab and develop the tools you need to go on for your future career. So for example, all of our students do intensive clinical rotations, which we'll talk about as an essential part of the program. And those put you in different hospital settings. There are some other options we'll talk about a little bit later, where you're in the clinical setting, you're at the bedside, you're looking at decisions that may be life and death decisions, seeing how those play out, understanding maybe which areas of medicine you're really interested in, or you learn about other kinds of healthcare jobs that might be really interesting to you. So one of the things that this program is very good for is discernment. We have students who know exactly why they're coming and exactly what they want to do when they go forward. But we have other students who want to take some exploratory time and see which aspects of either healthcare or other types of careers or research careers or regulatory careers related to human health and well-being are for them, or maybe learn about different career paths that they had no idea existed. So we do have a lot of advisory capacity where you are working with someone to shape your goals and your future. So this year is a particularly exciting year in our MA. It is the 25th anniversary of our program, making it one of the oldest in the country and best established. So it is a one-year program, which you can do, in the full-on, full-time burst of 9 months. It's a 30 credit hour program with requirements, as well as 13.5 credits in electives, where you work with your advisor to help shape a path for yourself to either get exposure or get skills and experience in the exact areas you know you need. Both semesters, there are clinical ethics rotations where you're spending 80 hours in a neighboring hospital system, which we'll tell you more about. We have, we don't know what some of this is going to look like in the coming year, given the pandemic. We have a number of short-term study abroad immersion programs where for a week or 2 or 3, students are going abroad. This year we had to convert these programs to virtual, where we were still collaborating with our colleagues in other countries, and they ended up going remarkably well, even though most people would have rather gotten on an airplane and gone to the different programs, which we'll show you later. As we said, we take advising seriously in this program. So as students come in, you're matched with someone who is likely to have good overlap with your goals, your pathway, your experience. But most students will end up developing advisory relationships with more than one faculty member. And maybe, Anna and Keely, maybe you can talk about that for a minute from your perspective, how you kind of navigated figuring out your pathway for your MA.
Yeah, I think what Dr. Anderson-Fye is saying about finding mentors is very true. I think for me, recognizing that anyone in our department is willing to talk to you about anything at any time is really important. I mean, you can walk into anyone's office at any given time and ask them a question, and you'll get 15 different perspectives back from each of our faculty members. And they're all really willing to work with students, and they all bring a little bit of something different to your experience. So for me, coming into the master's program, I knew I had an interest in clinical ethics and was able to do several independent studies with different faculty members. And I think that one of the really important things about both bioethics and medical humanities is that it's important to have different perspectives. So having that opportunity through our department was really great.
Absolutely. They're all definitely also very qualified, for sure. And funny, very funny. But yeah, no, I actually, the reason why I did the PhD was talking to a lot of the faculty. And I'm definitely very appreciative of every connection that I've made, especially the introduction into research. So yeah, it's been great.
Thank you so much. And the other thing that we do have are some really unique opportunities for students to assist in research. I've co-published with a bunch of students, as have most of my colleagues, to work with teaching, to work with program assistants. Those kinds of opportunities are pretty unusual for an MA. So it's a wonderful aspect of the program. We have a traditional program that will show you a grid of what the courses are, but we also wanted to let everyone know we have 2 concentrations. One is in medicine, society, and culture, and that is our kind of deep dive into medical humanities and social medicine. So that requires another type of foundational course seminar in the fall, that this fall will be co-taught by myself and a medical historian, world-renowned, who is the Associate Director of Medicine, Society, and Culture. And we have another seminar which is required, which exposes you to a variety of disciplines. Potentially, you might attend a talk at a museum or one of the hospitals, or many different alternatives to see different disciplinary perspectives on bioethics and medical humanities. And in the spring, for the clinical rotation, you have the option, depending on your career goals, to do some other sort of practicum besides another hospital rotation. So for example, some of our students who came in knowing they wanted to go on into a PhD in sociology, or go on to a law degree, or go on to other degrees, really wanted an intensive research practicum where their final project might be a publishable paper. We've had other students want to go work in federally qualified health centers, or our local clinic, or our county's Department of Public Health. So I had a student recently work in an organization that works with refugee health. So there are different kinds of options for the spring semester if that's the right fit for you. For many students, doing their second rotation of clinical rotations is the right fit. The other concentration we have is in research ethics, which requires a fall research ethics core intensive course. And again, you're working with your advisors to choose electives that have some relevance to research ethics. And then in the spring, all of these concentrators do a different kind of practicum in place of one of the clinical ethics rotations, which is an experience to work with your hands in something like an IRB, either at the university, at one of the hospitals, doing kind of research regulation, understanding what that takes. And then our research ethics concentrators also participate in a wonderful journal club of contemporary issues that is very student driven. And all of our students have the opportunity to participate in that as well. So the concentrations are certification that you have dived, in more depth into one of these areas or the other, and it is possible to complete both of them if you so choose. And instead of calling on Anna and Keely every time, I'm just gonna ask you, if you have something to say, jump in and say it, don't hesitate. And Dr. Jeanette as well. This is what the course, a typical course schedule will look like in the fall. So you can kind of follow down the traditional program. We have our Foundations of Bioethics courses, which are pretty substantial 6-credit courses that rotate through all of the basic perspectives and kind of major issues in bioethics and medical humanities. Your clinical ethics rotations, your electives, and a mini elective. So if you're going to do a concentration, one of those electives and your mini elective are already spoken for, and then you have some choice for your other one. In the spring semester, it's very similar. The Foundations class is more contemporary topics in bioethics and medical humanities by that point. So ironically, we had just completed public health ethics talking about things like epidemics and pandemics when we tragically found ourselves in the midst of one. So these kinds of topics that can be incredibly timely are what we do in the spring. Things like global health ethics. We might look at CRISPR-Cas9 stem cell ethics. The kind of cutting edge issues in bioethics and medical humanities. You would complete your second clinical ethics rotation or practicum. And all students do a capstone project in the spring. This is where you work with an advisor to dive in deep and become really an expert on a topic that you care passionately about. For some of our students, they walk in day one, or zoom in, as the case may be. We have to watch our metaphors. And they know exactly what they want to do for their capstone and are eagerly assembling, an advising team to do that. For other students, this is really a new world. And they're going to go through the fall and be exposed to all kinds of new topics, new ideas, and shape a capstone relevant to that. And that's a wonderful opportunity for a kind of mentored project. This year, we have several of those that are actually going to publication right now. So it's been an exciting year of very high quality capstones. Then you would take your other electives that may or may not be related to a concentration depending on your interests. And a word about our courses and our electives. The curriculum is a little more flexible in that we do not only offer the traditional 3-credit courses that people are used to in their undergraduate education. We offer shorter kind of 1.5 credit courses, which may be really innovative topics or kind of experimental topics in bioethics and medical humanities. Some of these recently, our vice chair, Dr. Goldenberg, teaches a fantastic course on the bioethics of Star Trek, which is very popular and really astute. I taught one this past year on environmental ethics and human health. We have them on representations of mental illness in film. There's a whole bunch of these kind of exciting topics in 1.5 credit. Also, some of our 3-credit courses are taught as intensives over a couple of days or a week instead of spread out over the entire semester. So once you were starting to look at your coursework, you might also think about the pacing, think about your learning style, and think about putting together a kind of semester of courses that are really complementary to one another as well as to your educational and career goals.
Dr. Anderson-Fye, we have a great question. So the question is, how does one measure success in such a program? I mean, grades are not important in the sense of the context of what you're learning when it comes to these subjects, but to be certified and earn a degree, how do you give grades or projects or tests? How do you quantify the learning process here?
What a great question. And I would actually love to hear the backstory of that question. So there's a couple different answers to that. These are graded courses. So each course lays out the learning objectives and the assessments and how you're assessed. The goals of the courses are not always the same, but it is what is required of you, what is asked of you is made explicitly clear, and you are aware of how you will be graded for each course. We are aware that assessment is really important, both to kind of show mastery, so you truly and deeply understand a topic, an approach, an analytic approach, or whatever it is. And also because many people leave this program and are going on to apply for other programs, other jobs, where their grade point average really matters. So actually, Dr. Jeanette, why don't you talk for a minute about the clinical rotations and how those might be assessed?
Sure.
And then, and talk about that. And then we'll talk about some, I'll talk about that assessment as we go on in other kinds of contexts and other kinds of pathways.
Great. So yeah, we have an amazing part of our program that is one of the biggest reasons that folks join us is our clinical ethics rotations. These have been fundamental to the program since the beginning of its inception. And students spend 80 hours per semester rotating at these different hospitals. So Cleveland is very blessed to have 4 major teaching institutions in our hospitals. Cleveland Clinic Foundation, the Lewis B. Stokes Veterans Administrative Hospital, which is actually the 4th largest VA in the country, Metro Health System, which is the county hospital, and University Hospitals of Cleveland. These 4 institutions are very different, which provides with a wonderful comparative experience when you're looking at semester 1 versus semester 2. So these are observation rotations, and students can attend ICU rounds, all different types of interdisciplinary meetings, attending different types of psychiatric care, emergency departments. Sometimes you're rotating with a full team, sometimes you're rotating one-on-one with someone. Sometimes you're attending committee meetings, such as ethics committees, IRBs, rehab meetings, transplant selection committee meetings. There's a whole host of options at each institution. And this course, the focus really is on gaining the experience, being in the hospitals, rotating those 80 hours. And so this course particularly is designed to be a pass-fail course. And so as students complete their rotations, they meet once a week with a preceptor from the hospital system to talk about what they've experienced, to discuss the ethics, the nuances of that system itself. And they submit weekly logs and journals about their experience. And then they do 2 case analyses throughout the semester. So they identify 2 different cases that really stood out to them that have some ethical challenges as part of that case. And they write an analysis of that. And provided students complete all of those things, they then would receive a pass for the course. We try to do 1 semester public, so either the VA or Metro, and then 1 semester private, so either Cleveland Clinic or University Hospitals. I'd love to hear from either Anna or Keely what your experience was for the clinical ethics rotations, because I know that takes up a lot of your time, and so you guys definitely spent time doing this.
Yeah, I think the clinical rotations are a great component of the program. I spent last fall at Metro, so I had the public experience, and then I spent the spring at University Hospitals. I got quite a few of my hours in before we went virtual. But I think it's a great environment to gain an appreciation for ethics outside of talking to bioethics people themselves. So it's interesting to get the perspectives of physicians and nurses and social workers about, what the role of ethics is in healthcare. So it's great exposure. You learn a lot from it. And you gain an appreciation for how complex a lot of cases in hospitals are. And it's a little bit different experience than maybe you've had as like a patient in a hospital. So it's great exposure.
And we get those case studies in the foundations course for sure, but it's very different to experience it firsthand. I did my first semester at Metro, and then it was a unique case. I didn't end up doing rotations the second half. I did a practicum at UH. But yeah, it's interesting to do rounds with residents. Because I mean, you're supposed to be observing and learning and taking everything in, and you're supposed to be quite quiet, but they really they're interested. It's clear that they also haven't gotten, maybe, depending on where they've gone to med school, some of the exposure of specific topics that we've gotten throughout the program. So every now and then you'll get a question and it's like, oh, I can speak on this. So it's cool. It's a really cool experience.
Thank you so much for sharing that. So
Thank you. Yeah, let me say one other thing about the assessment question, Dr. Jeanette, which is simply, the other thing that I would say as a blanket to our classes, they don't tend to be exam-based, which is not to say you couldn't find an elective that would be exam-based, but this working in the worlds of bioethics, medical humanities, part of what you're learning is how to make an analytic argument. Some of those, your capstone is a little longer. Other courses like our Medicine, Society, and Culture analytic papers, they're very short, they're very pithy. But the program assessment tends to be based on a combination of some sort of writing, oral presentation, which is very important regardless of your career going forward. That's not true in all courses. That's not true in foundations. There are other types of participation, and in a kind of hybrid Zoom world, we may have chat boards, we may have, other types of interaction, or breakout rooms, things like this. But it's some combination of usually some kind of paper assessment, which can look a little bit different from course to course, participation, and sometimes presentation.
So I'll, move us ahead. So we also, as was mentioned before, offer bioethics study abroad courses. These courses are designed to be 3 credit hours, but they're done in an intensive way. So as was mentioned before, they can be over a week or 2 weeks. Typically they take place over spring break or in May once the spring semester is completed. These are just a small sampling. These are the current courses that tend to be offered, but we've done courses in other places. Yellowstone National Park, Norway, Brazil. So there's always the potential for new courses as well. But I think what's great about these is it allows students to think about bioethics from a global perspective. And the idea of bioethics and medical humanities really can also vary depending on the culture and the society that you are in, and what is considered important or critical to that discussion. And that can be seen in their public policies and the way health is approached. And so these courses are a wonderful way to do that. And it also helps you then think about our, the US, the Western context as well.
All right, so in the fall of 2020, so looking at an unusual year, like everybody else, we kind of transitioned on a dime this spring to do remote delivery. And right now we are looking at what the university calls dual delivery plans for the fall. So as you can see on the slide, the core principles that are guiding our decisions and the decisions of the school and university are the health and safety of all of the students, faculty, and staff. And I think you'll feel that in so many different ways at Case Western Reserve. And at the same time, we are trying to maximize the student experience for all students and give that kind of sense of community, sense of advising, sense of interaction that is really a hallmark of this program. So we're finding, the kind of guidance at the federal level, the state level, the regional level, the university level, that keeps, it's shifting. No one has 100% knowledge of what it's going to look like in the fall, let alone over the course of the year. But basically, we have prepared for almost every scenario we can possibly think of. So if we have the ability to be in person, we have courses that potentially we can map out with social distancing. We have courses that could be done hybrid. We have all kinds of activities and plans for online and Zoom-based delivery, etc. So the one thing we're planning for is being able to be flexible. The other thing that we learned from this spring is how to really listen to students. For some students, many aspects of the Zoom actually provided more interaction, better interaction, and opportunity. And there's other things that are really, lost. But we're looking at all kinds of potentialities. For example, if our students are not able to join us in the fall, it is possible that we would have collaborators around the country in different countries, so students could think about engaging both virtual clinical rotations, which we were able to do, and also something in their own hometown where they are during pandemic. So those plans are still, they're changing from the top and from what the policy and guidance is. But on the ground, we have been working diligently and systematically to be prepared for come what may. I don't know, Dr. Jeanette, you are one of those people who has been actively preparing. What else would you share about this?
I think you summed it up very well. I would say one of the things we've had to become accustomed to and frankly comfortable with is, making decisions and moving forward based on today's information, because we don't know what tomorrow will bring, or next week or next month. And so we've had to just be comfortable with that. And ultimately that results in us learning to be flexible and adjust as new information is made available to us.
And what I would say also, I would invite anyone, if you have questions about what your specific situation could look like, just go ahead and give us a call or email, and we can talk to you about the contingency plans for someone who is in your specific situation. So as was mentioned earlier, we do have a number of students who choose to do dual degrees. You can see some of them there from JD, MD, MPH, other master's degrees and PhDs, along with the MA. The benefit to this, you do need to apply and gain acceptance to each program individually, but they generally save students a little bit of time and money going along. So this list of program outcomes is by no means comprehensive, but it gives you some examples of where people have gone recently for further study. You can see kind of all over the country and internationally. Students go on to become, a huge array of professions, from academics to data analysts, case management, clinical ethicists. You can read the list for yourself, but a huge variety, because really any profession related to human health in any way needs people who are trained in the ethics and humanities of health, illness, biotech, etc. So it depends where you specialize. I often picture a kind of hourglass shape diagram where our students are coming from a broad base. They are having this intense experience together and then going on to a wide array of professions. And it is exciting actually to watch our alumni networks have each other for the rest of their career. And 25 years out, people remain in touch. They have not only horizontal networks with their class, but we are also having various types of mentoring relationships where newer students and newer alumni can connect and network with alumni who are a little further out. And you can see there as well, a bunch of wonderful universities, medical centers, and companies, organizations. We have people go on to nonprofits, etc., out of this program directly and as they continue on with their education. maybe Keely and Anna are best students to speak to this, but our students generally form just amazing cohorts. People come in, we got the question and the Q&A from all over the country and all over the world. Obviously, the kind of international experience is down a little bit. A couple years ago, we had students from 22 different countries. And really form a cohort here. There's a variety. Actually, I love the pictures here represent intramural sports team. Being at the American Society of Bioethics and Humanities conference with a number of our students. The university owns a wonderful farm where we usually have welcome picnics and all the sports activities of Cleveland. We have found that people are getting together for various kinds of virtual activities. So we have those going on as well. In terms of student life and community life, it is incredibly rich. And I believe it's the next slide. It just gives you an introduction for people who are able to come to Cleveland. It's an incredible city. It has all of the resources and riches of a big city in terms of theater and sports and museums and an incredible food scene. But it's so much more accessible in terms of getting to places, getting reservations, being able to afford tickets. Our city loves our students, and there's lots of student discounts to various activities. The largest theater district outside of New York City, you know, an incredible world-class orchestra, world-class museums within walking distance of our department, a national park who actually we are developing programming with right now and partnering on some of our environmental ethics and human health initiatives. So it's a really lively place to live. And if you are here in person, Cleveland and Cuyahoga County, they have been doing a wonderful job on creating socially distant opportunities, trying to keep people safe, but also still being able to use and enjoy some of the wealth of resources and fun in the city and in the region.
I can just jump in and say, like, obviously Keely and I were fortunate enough to do our undergrads at Case too, so we've spent several years in Cleveland now, and I know at least I personally fell in love with Cleveland. I think it's a great place to be. I think that there's a lot to do, and with such a diverse student population, the master's program also has integrated graduate studies students, so you've got students that have experience in Cleveland, and then you also have students that are coming in brand new and don't know a single person in the program, and I think it's a great way to meet people and like find your people in a sense, and there's always things going on and things to do, so definitely even if you don't know anyone, like it's a very comfortable place to be.
Absolutely. And even if things don't improve with COVID, the metro parks or something, like I've been able to get outside. We have the cultural gardens, like literally right up the street from campus. So there's still a lot to do, even if COVID doesn't improve. It's a very underrated city for sure.
Thank you.
I'll also add, I am from Cleveland, but I feel like Cleveland is a very underrated city. We don't have great public relations in terms of how we present ourselves, but there's a lot going on here, and it's really exciting.
Although it's getting better. Like if you know, the
is.
Museum of Art was named second best museum in the country after the Met, and they're a programming partner of ours. You know, our MA students have the opportunity to do some activities with them. You know, all of the sports teams, we finally, you know, got some championships. You know, the orchestra is usually ranked number 3 in the world. You know, it's just extraordinary.
And I think that stuff is what makes Cleveland great, but no one knows. No one knows we have this exciting stuff here.
So we get questions about financial aid quite a bit. I alluded to earlier that a rare opportunity that is in our department are student assistantships. The priority deadline for that has passed, so it's unclear what would be available still for those. I think the priority deadline was June 1st, where we are assigning the assistantships. Other sorts of, but other students are wanting to volunteer on projects so that they get research or publication experience, things like that, and that is continuing. Our financial aid office at the university is great, and you would fill out the FAFSA like you would for any program. And then there are different kinds of traditional financial aid options. And a number of students will do work study or will work some other kind of job. The programming and the hours of the courses, you have a good amount of say over how you plan out your schedule, with just a few exceptions. So most students who want to work or need to work part-time or even full-time are able to do it while they complete the program. So you can contact Graduate Studies and Financial Aid or contact us to talk about that. So the application process is fairly straightforward. We need all of your transcripts, a short personal essay, really talking most about the fit of this program. We want every single student who comes to the program to have a good fit. Why is this the program for you? And that is one of the things that we're assessing when we do our interviews. We need your CV or resume, letters of recommendation, and this year, because of pandemic, your standardized graduate tests, that's optional. If you have taken one, you have a score that you'd like to send in, you may, but we are not requiring the test for the first time ever this year due to the challenges of the pandemic. And we have waived the application fee for the rest of this cycle. The final deadline for application for the program is August 1. So that is coming up soon. If you're interested, contact us ASAP and let us know. And Dr. Jeanette or someone else can help walk you through the application deadline. So in our timeline, we're reaching the end. Final application, we're trying to review them very rapidly to fill our last slots. And orientation is on August 21st, which we are already working on diligently now. So that is an overview of the MA in Bioethics and Medical Humanities, and we really welcome your questions. And Dr. Jeanette, Keely, Anna, any other reflections are very welcome.
So I'm looking at the Q&A, folks, and if you want to continue to submit them, we'll read them. So there's a question here. Are professionals involved in the various clinical settings very open to the students in this program? Do they generally have enough time to extensively explain the nuances to the difficulty of the ethical questions they need to make regarding specific patients, critical care policy, etc.? So that's a very loaded question. I would say, in the clinical ethics rotations, it would depend on what specific setting you're in, right? So if you're participating in a morning rounds, the likelihood is that, the attending wouldn't be able to spend 20 minutes going over just the ethics of that patient. But, in some settings, for instance, in some of the places or hospitals, you're rotating one-on-one with someone. And so you might be able to sit down with the person you're rotating with and really understand the nuances of that specific situation. The one good thing that we do is that the group that's rotating at the hospital meets on a weekly basis in a preceptor meeting. And so you are able to, as a group, talk about those things, go through the nuances, have discussions, and you get to hear from someone who's in that hospital system, but also your fellow students who are rotating there as well. So it's a great question.
In addition, if clinical ethics is something that is of particular interest, there is a fantastic course that is a 3-credit elective course that is an intensive clinical ethics course that is a great place to dive in depth on those questions. And Anna and Keely, you've had experience, so you could speak to that also.
Yeah, I was just going to say, I think that it very much depends on the circumstance. Like, if you're on rounds in the medical ICU, typically the medical students can answer questions off to the side, or I have found for the most part, physicians are willing to stay afterwards and answer questions, and they'll tell you when it's appropriate, but you can get those questions answered if you have them. And if not, absolutely going to your preceptor and bringing those questions every week is a huge part of the discussion. So I guess that's my take. But I also would say that, like, for example, I've done rotations for 8 hours with one social worker, and it's just you. So, I mean, that one-on-one experience of whenever you're walking to a new patient's room, you can ask all the questions that you want, and they'll prepare you to walk into the room. And I think it just very much depends on what you're doing.
Absolutely. And it also depends on the attendings too. Because like, I think it's appropriate to assume that you shouldn't say anything just because you are literally seeing patients. Like, or when I say seeing patients, I mean like physically listening in on the decision-making process and all of that. But yeah, for the most part, at least at Metro, they definitely like were fascinated. Some people were fascinated by the MAs. So like I get like questions, quick little questions about ethics and all of that. So yeah, it's certain ones are casual, certain ones aren't, but it's still good to listen in.
All right, so the next question is, if you have a committee letter from my school for medical school application, would that suffice in place of 3 letters of recommendation? There are more than 3 individuals who contributed. Absolutely, that would absolutely work. I would recommend contacting us. You can email us bioethics@case.edu, and we can make sure that it gets submitted either through the application itself or emailed to us from your university. So yeah, we can speak more to your specific situation. All right, there's 2 questions that are kind of related. So how will the MA program look for a case employee, and can the program be completed part-time?
So those are great questions. And I would say a couple of things. One of the easiest answers to that is we have a number of case employees who have done the program who probably would be willing to speak with you about that. But we absolutely have people who do the program part-time. It depends on what else you're doing, how we try to phase that out for you. So that, you know, usually is better handled in a kind of one-on-one discussion. For example, most people really want to get foundations in first. And you would want foundations probably before you hit other kinds of courses or clinical rotations, but not always. So a little bit of it is going to depend on your schedule and your goals. If you think about all of the dual degree students we have, they are really taking the program on a part-time basis also. So we are very used to, in any given year, having our full-time 1-year MA students, and then having students who may take 1 course a semester, or possibly more than that, maybe rotations over the summer. But there are many different ways to pace out the program, and we have, you know, decades of experience kind of working with all the different iterations of that, and are happy to think that through with any individual.
Any other questions from our attendees? All right, how about this question? What sets Case Western Reserve apart from other master's programs of similar caliber?
That is a great question. I will begin with that one. You know, one of the things we hear all of the time is definitely about the clinical rotations, that our 25-year histories with these 4 hospital systems, our students' excellent reputation, and the way that students are welcome into the clinical rotations is definitely something very special nationally. Is something else very unique about our program is that our faculty not only are interdisciplinary, coming from all kinds of different backgrounds, whether it's analytic philosophy, other kinds of humanities, social sciences, MDs, JDs, people who truly are looking at, kind of taken as a whole. We're a very holistic program, and we try to balance our faculty so that that's the case. But all of our faculty are research active. They are, the best in the country and the world at what they do. And they also care passionately about students, about advising, about teaching. And I will say, watching our faculty think carefully about dual delivery, about the content and programming of what we are offering, about continuous improvement of what is taught and experiences that are offered in the program has just been so inspiring this spring and this year, to say that this is incredibly true. The kind of academic excellence, research excellence, folks in our department are setting policy locally, nationally, internationally, and they're hands-on with students. So that kind of education that is both broad and deep, with the kind of richness of the faculty we have, is pretty unique. The other thing I will say we get a lot of feedback on is that our networks are so good after 25 years of successful students leaving our program that people find networking in all kinds of different fields. They find people who light up because they have the Case Western Reserve MA in Bioethics and Medical Humanities as part of their educational trajectory. What else would others add?
I think that for me, the research opportunities within our department are very wide. While I know that we talked about research assistantship positions, I think that there's a lot of opportunities even beyond that to consider how you can have an impact on not only the bioethics community, but kind of health and humanities more widely with the work that you're doing. And I think Dr. Anderson-Fye mentioned earlier, like students that are publishing capstones and independent study papers. And I think that there's really a platform for you to bring about a difference in this program, and there's faculty that are willing to do it with you.
And they're willing to do it with you regardless of your background, I think, which is really important. I was a little worried. I had only really done like qualitative research, and I looked at policy for the most part, but I was able to get a research assistantship because of one of our faculty members. I casually called her office, and she said, absolutely, I can get you in touch with the right people within our office, and we'll get you right in there. And it obviously was affected by COVID, but I was just so wowed by the fact that it was really that easy, just making a call and saying, hey, these are my interests. And then from there, it was like, yep, this is what you're going to do.
Well, and I mean, even on top of that, like once we went virtual, faculty are still willing to meet with you, and you end up on Zoom calls with them and that kind of thing, where it's not like you go online and no one is able to be reached anymore. And I think that was also a unique experience, that while there's some uncertainty going into the next year, there's, regardless of what format maybe things end up being in, there's still going to be opportunities for research and for working with faculty and that kind of thing.
So we have another question that came up. So I'm sorry if you already mentioned this, but I missed it. But is it only this fall semester that may be done remotely? Is there currently no guarantee that you could do the entire master's program online at this time?
So I will take that. We are recognizing that people are in all kinds of different situations, and that we are preparing for the contingency that some students may end up doing the entire program remotely, and that is a possibility. Obviously, that is not something, you know, we have done in the past. This year, we ended up having an abrupt hybrid. But through that, we were able to pilot things that on first glance are more difficult, like clinical rotations. And so that is absolutely a possibility if it is in a student's best interest. And again, this is probably where I would recommend that if you are in a situation where you might not be able to come to Cleveland for the entire year or for part of the year, or you're thinking it might be best done remote, it might be, you know, a great idea for you to contact us and talk about your situation, to know, you know, we may have remote collaborations in your city, or you might, you know, think about doing the entire thing online, and we can tell you what that's looked like this year. So we can definitely have those conversations, and we're thinking very flexibly going into this year, because even if we planned out with exact plans, things can change on a dime, as we've all learned this year. So that's what we're preparing for. But we've learned that the quality of the educational experience can be consistent and can be excellent in many different formats. And in fact, there are a few things that we've piloted with remote formats and Zoom formats, excellent, and have gone so well that we're planning to keep them a full-time in-person situation. These are great questions.
Yeah, they're excellent questions. So for the sake of time, I'll wrap us up. We've gone past our 3 o'clock stop time. So thank you to everybody who joined us, asked wonderful questions. Thank you to our panelists for joining us. We're sorry that Dr. Aulisio couldn't stay on beyond his power cutting out. But thank you so much to everyone. I will just reiterate, if you have any questions, you want to connect with a recent alumni or a current student in the program, please email us, bioethics@case.edu.
Thank you so much, Dr. Jeanette. And thank you, Anna and Keely. Really appreciate you being here. And thanks for everyone for coming. And if a question crops up for you afterwards, don't hesitate to contact us.